The should focus on to this. The Gauteng Department of Health has reiterated that it will not be able to absorb all temporary contracts of various category workers when their contracts end at the end of March 2022, and that's due to budgetary constraints.
We have met with all the CEOs to look into the matter, reorganize, and explain to us where the need is in terms of filling those particular positions. Unfortunately, with that 50% cut of budget, we won't be able, to reappoint all the employees that have been appointed through COVID. We understand that it's still with us, but we cannot even at this particular point in time reappoint all of them, because that will be highly irregular and exposes us to unnecessary audit queries with the Auditor General. So at the moment, we would like to state it very clearly that, the number of staff members, that are involved, it's not true that it's 800 doctors and nurses that are going to be released, but that is work that we're currently doing to ensure that, for instance, if Steve Biko does not need 3 more doctors, what they will do is that the doctors will agree, if the doctors are needed at Bara, that Steve Biko will now reorganize that funding for the 3 doctors and redirect it where it's needed. So we are now waiting for all the CEOs and clinicians involved on this project to advise the department as to, with that 1.5 billion, how are we going to reorganize staff to ensure that we are not compromised, as I've stated earlier, that COVID is still with us, and we wouldn't like, to appoint employees at this particular point in time without adequate budget, because we'll end up with the same situation that we had, with the medical interns that were appointed without a budget, and later on we might not be able even to pay.
Let's get you more detail in terms of what transpired from that briefing. We're joined by Newzroom Afrika's Malungelo, Booi. Malu, let's start with the issue that was raised by some of those who were picketing yesterday, that they would need to take money out of their own pockets, but only to find out today that they are not employed by the Department of Health, and that it's just an issue of bread and not other supplies.
Interesting, isn't it, Duduzile? In fact, I can tell you this: when I was talking to one of a contact of mine in this facility, who was actually saying that things started to normalize in terms of bread this morning, and that because, and he attributes that essentially to what happened yesterday. And of course, this morning we're seeing that, that top panel of health officials from the health department briefing us about what we saw yesterday. Essentially, Duduzile, they are in a crisis mode, and they're trying to put out the fires, because what happened yesterday, seeing top clinicians from this particular hospital and staff members from this particular hospital picketing over the issue of employment of their colleagues, and also the issue of food in this particular hospital, is something that is actually embarrassing to the health department. That's why we saw the health MEC and some of her top officials holding that press briefing. In fact, we now know, Duduzile, that in fact there was an issue with bread in this particular hospital for about 3 months, because suppliers were not for 3 weeks, rather, pardon me, Duduzile, 3 weeks, because suppliers were actually not paid, and that's something that authorities from the health department have considered to, and they're saying that that problem has now been addressed. But they're saying, they do have supply payment issues, and some of those issues really emanate from the queries that they have on some of the invoices that have been submitted by their suppliers. But they're saying that they're doing everything they can to address that particular concern. Of course, Duduzile also saying that there's never been a food issue here besides the bread issue that was experienced about 3 week for about 3 weeks here at Chris Hani Baragwanath Hospital. But also, Duduzile, one of the things that is also coming out strongly is the issue of the staffing in this particular hospital. It's something that you've already alluded to, that we know that all in all in this province there are over 8,000 nurses and doctors and other personnel that were hired by the government to assist, the Gauteng government to deal with COVID-19 patients in those facilities. We know that those contracts will not be renewed at the end of this month. Authorities saying that they simply don't have, the money that they need. In fact, they're saying that previously they were given about 2 billion rand for those posts. That money has been cut into half. They've got now about 1.5 billion, and that's why then they're saying that they will have then to they'll have to release some of these, employees who have played a critical role really in helping COVID patients here in Gauteng. But what's going to happen from now in relation to that, though, they're saying that they will actually, the CEOs of some of these hospitals will make submissions to the department, telling them where their needs are, so that some of these 8,000 employees could actually be placed where there's needs in those hospitals. We know, for example, here at Chris Hani Baragwanath Hospital, there's about 800 workers who were employed through that COVID-19 process, and the concern was that those workers will lose their jobs. But what will have to happen for some of those not to lose their jobs, the CEO of this hospital will have to say, I need some of those employees. But she has indicated that the hospital does need some of those employees to be retained. Duduzile.
And this with the admission that the Gauteng Department of Health is indeed feeling the effects of PPE corruption. Malungelo, Booi, that's where we'll leave it. Thank you very much for that update.